call upon Dr. Madan Kamble, a colleague of mine. He's an MBBS MD, consultant OB/GYN and sex counselor chairperson, AMOX Sexual Medicine Committee, National Co-Coordinator, Foxy Health, Sexual Health and STI Committee, past secretary and president, Uplus OB/GYN Society. He's a member of CSEPI and ISAR. He's a recipient of Wonder Amoxian Award in 2022, and he has a publications on his name with Amox focus on sexual health. All to you, Dr. Madan.
Welcome all for the presentation.
Talking on a subject which is actually very less discussed, and it is a very important aspect of life, of every woman's life. This needs to be addressed by every doctor or any clinician, obstetrician or general physician. Everyone should know few things about the relation between the pregnancy and sexuality. I will be discussing this topic in few important points like factors affecting the sexuality in pregnancy, studies of sexual activity in pregnancy, possible complications of sexual intercourse in pregnancy, and the circumstances affecting the postpartum sexuality. As we know, the sexuality in pregnancy is still a superficial matter which is surrounded by many myths and taboos. And pregnancy is a phase of intense changes in a woman's life that includes the fear, anxiety, insecurity to women. At the same time, there is joy of pleasure and also satisfaction of generating a new life. There are so many physical changes in pregnancy which are affecting positively and negatively to the woman's sexuality. And woman is God gifted for her ability to produce another life from within. It is the only state in the life of a woman which takes her life a completely new role which is irreversible. With 9 months of pregnancy and so many hours of labor and countless weeks of midnight fits are very crucial. And woman may need 6 to 8 weeks to regain her physical and mental status to the normal. Let us discuss the factors affecting the sexuality, such as the biopsychosocial factors. Sexual perceptions that includes the desire from either of the partners, whether they are having desire to have a sexual relationship, or feelings of attractiveness, fear of sexual intercourse is there, feelings of fear and guilt towards the baby. There may be feeling of pain during the sex. And about the sexual activities during the pregnancy, there are so many changes in the frequency of sexual intercourse. Sexual activities during the birth week are different. There are different types of sexual intercourse they are having or experiencing. And there are so many changes in sexual satisfaction and desire, and that we have to address them with. Then about the sexual dysfunctions, there may be decrease in the desire and arousal, and also there may be difficulty in orgasm, or sex may be painful. And changes in libido may be decreased or increased depending upon the different trimesters. Sexual changes and adaptations during the pregnancy. The woman may feel ashamed due to the body disfigurement causing the shyness and lack of creativity. We can advise the change in positions to make sex comfortable. Generally, women adapt to the sexual practices as per the need, so that couples should not lose their intimacy and they should enjoy the pleasurable relationship or intimate relationship. Then living positively with these physical changes. How they do? There is increased sexual desire and performance many times, and women may feel more beautiful. Women experience changes in their body and psychic image in this period. At the same time, there is greater responsibility and feelings of femininity, and that improves the couple's relationship. The libido pattern during pregnancy. As we know, in first trimester there is decrease in the libido, sexual tension and effectiveness performance declines. To the opposite, in second trimester libido may be high, and they may feel the intense or multiple orgasms too. In third trimester, libido pattern may be variable, sex may feel uncomfortable as the birth approaches. Then about the physical aspects of sexuality in pregnancy and postpartum. In hyperemesis in early pregnancy, there may be fatigue, heartburn with reflex esophagitis. There may be urinary frequency and urgency, constipation, fetal movements and back pain is always there. Breast can become tender, increased vaginal secretions are there. There is vasocongestion, engorgement of genitalia. They may feel cramping or muscle pain or dyspareunia may be there. Sexual arousability of mothers is physiologically reduced because the walls of the vagina are thinner and orgasm is less intense. There may be PV bleeding or lochia, leaking or sore breast may be there, prolonged sexual abstinence is there. There is vaginal dryness due to the hormonal changes, risk of injury to uterus and vagina in cases of operative vaginal delivery and previous cesarean cases. Then what are the psychological aspects which are affecting the sexuality in pregnancy and postpartum? There will be diminished or absent sex drive due to the hormonal changes. Lack of time for intimacy is there. Lack of privacy is there. Sometimes there is small house is there, large family that is causing the lack of privacy. A mother is many times exhausted due to the baby feeding and care. There are so many physical and mental fatigue, depression, lack of sleep and mood is there. Always at the same time there is fear of unwanted pregnancy. There may be low self-esteem, self-confidence may be low, disfigured image, decreased attractiveness is there. At the same time, the more attention to the baby has to be given by the mother. There is always a confusion caused as a new role as a mother. There may be fear of waking the baby. Anxiety over parenting is also one of the issues. And what are the benefits of sex during pregnancy? Orgasm may be better due to the increased blood flow to the genitals. This keeps both the partners fit, fresh and alive, active. And this is going to increase the bonding between the partners and there is increased happiness due to the release of endorphins. There are some complications due to the sexual activity. There may be fear of danger to the fetus in utero, risk of bleeding or abortion may be there, fear of vaginal trauma, premature rupture of membranes may be there, fetal distress, vaginal infections, chances of pelvic inflammatory disease, patient discomfort and anxiety is there. More risky may be there in cases of previous cesarean or placenta previa cases. Some chances of venous air embolism may be there. There are so many questions are there in the mind of pregnant lady. Is the sex safe in pregnancy? Will it cause a miscarriage? Will it harm my baby? Are there any sex position to avoid and to prefer? What to do and what not to do? There are so many questions. Generally, we don't give so much time in our AMC clinic to the patient. It's my suggestion and request to take 2 to 3 minutes more to ask your patient. Patient is not going to ask on her phone. Now, when to avoid the sex during pregnancy? There are some situations where sex should be avoided. The cases which are at risk of miscarriage or past history of same. The cases of preterm labor or if there is past history of same, in patient with PV bleeding or leaking, cases of placental malpositions, cases of multiple pregnancy, cases of IVF conception or prolonged infertility. Which are the safe sex positions which are comparatively or relatively considered safe? Either the classic missionary position is there, modified missionary position, doggy style is there, scissors, spooning, side saddle, and a moon cup. These are few recommended positions. The objective behind this is there should not be any undue pressure on the abdomen of the pregnant lady. That is our objective. What will happen if women don't want to have sex? Yes, there is role of intimacy, great role of intimacy. Share your needs and concerns with your partner in an open and loving way. There are also other ways of intimacy. They can enjoy the cuddle, kiss or massage each other. Also, they can enjoy the bubble bath together. They can enjoy the masturbation too. Some special precautions need to be taken. Use of barrier contraceptives to prevent the sexually transmitted infections. They can enjoy the foreplay and also can enjoy with the safe positions, just we have discussed. They can use the lubricants if vaginal dryness is there. Oral sex can be safe, but it should be with proper hygiene and precautions. Avoid alcohol and smoking. Anal sex will not harm the baby, but it may be uncomfortable if woman has the pregnancy-related hemorrhoids. But to avoid the anal sex followed by vaginal sex should be followed to avoid the spread of infections. We should advise the supportive care to the patient. We can should advise healthy and balanced diet. They can have the routine exercises and fitness. Try to work out a goal and get your partner involved. Always give compliments to the pregnant partner. Wow, you are looking so beautiful today. Wow. So we can give the compliments. She will be very happy with this small compliment, and it can definitely boost her fragile self-esteem. Get out of the home for a trip. Get advantage of the urges when it strikes. Advice to the husband is to be patient. And advice to wife, show some attention to your husband. Always there is great feeling of seeing your wife in action as mother and working you alongside as a dad. Even though your sexual calendar is empty for a while, your new role will keep you busy and fulfilled. Sexual satisfaction do not change in the pregnancy compared with the pre-pregnancy patterns, despite a decline of sexual activity during the third trimester. We should assure them that sex drive may wax and wane during the pregnancy. The couples need to communicate clearly about their desires. The pregnancy and the postpartum period need not be the times of sexual frustration for the pregnant couple. Pregnancy may be an ideal time for the couple to develop and increase their sexual awareness, responsiveness, and intimacy with one another. What can we do as a clinician? What is our duty? Give accurate information and dispel the myths during the prenatal care. Counseling has a great role. It can relieve the couple's anxiety and enhance adjustment to their changing relationship, which may prevent long-term conflicts. Advice regarding declining sexual satisfaction during the pregnancy and childbirth should be given. We can give anticipatory guidance that sexual expression may get affected due to the breastfeeding. They can use water-soluble lubricants if vaginal dryness is there. And discussion of expected changes in the sexuality should be routinely done by the doctor in order to improve the couple's perception of possible sexual modifications induced by pregnancy. This should be done in the ANC period as a part of counseling. Yeah. Thank you for patiently.
Thank you, Dr. Madan. Thank you, Dr. Madan. You almost cleared all the queries of pregnancy and sex during pregnancy. I hope there's no question at present.
I just
One
want
question.
to ask, is there any difference between the three trimesters, which is the safest and which is the one which is the most risky?
Actually, in first trimester, sexual intercourse should be avoided because there are high chances of heavy bleeding or an abortion, or if there is any past history of abortion. That is better to avoid the sex in first pregnancy. And if it is high risk pregnancy, then it should be avoided. Comparatively, second trimester is safe, but with precautions.
And third?
And in third trimester also, better to avoid the intercourse in that third trimester.
In Delhi conference, you remember, they said all the three trimesters are the same.
Sir, you are right. What Dr. Madan is saying is absolutely correct. It is true. What book says, there is no for sex during pregnancy. That is what sir is trying to tell. But one slide has already shown, which he has shown, there are some conditions when actually you should avoid. One is placenta previa, second is recurrent abortion, which sir has covered already, if I am not wrong.
That is correct. But grossly, in uncomplicated pregnancy, sex is to have sex is safe. No major issue.
Dr. Madan, how many times you have been blamed for some untoward incident for advising sex during pregnancy? Have you ever been blamed by anybody?
Not at all actually,
Right. Thank you.
but we have to give some information to them and at least guide something.
Thank you, sir.
Yeah,
The rest
thank
of the
you.
questions we can take at the end of the session.
Yes.
Yeah, we can